In my capacity as chair of the members of European Parliament Group for Kidney Health, I'm pleased to welcome you all to the 2016 European Kidney Forum, and I express my gratitude for your presence here to discuss an issue of fundamental importance for improving public health in Europe.
Improving lifestyle and diet in the general population before kidney disease strikes has more socioeconomic impact than secondary prevention and treating just patients who have already a moderate degree of the disease. Starting from this, it would be useful if the EU harmonizes its efforts into education and in changing lifestyle and also in improving food labeling. I think an important point is that there are huge differences among European countries as well in health style attitudes as in the approach of the governments, and it would be very useful if the governments learn from each other what each country is doing so that they can copy what seems more adequate to them than what's happening in their own country.
The very powerful European financial instruments to achieve concrete results in this area, because that is what is needed. And in this way, we will contribute.
Mr. Martin Sechel's talk was essentially focusing on the importance of chronic kidney diseases, the heavy weight they have on the society and on the personal individuals within Europe, and also on the fact that prevention was of much help to decrease this burden.
So, prevention does lead to improved health. Good thing. This is what we heard from Dr. Sechel. But this also leads to lower costs, basically, lower annual costs.
Professor de Pouvourville from Paris. He is a health economics expert, and in his talk, the main issue was that primary prevention, as a matter of fact, is also economically efficient. So not only it brings more health to people, but if you sum up all the advantages and economic productivity, healthy aging was less expensive to societies than people who get chronically sick and for that reason die earlier. There is a debate going on what the EU should do. Should they make regulations that impose on industry to make their food production healthier? Or should there be only advices without obligations for industry? I think that the group altogether thought that it was better to impose regulations just to make sure that the necessary changes occur.